Hi, I'm Dr. Hisham Atwa. Welcome to our Orbera informational video. In the next few minutes, we will discuss an exciting new tool in helping patients overcome their problems with obesity. Do you feel that excess weight is keeping you from enjoying the healthier, more active life you want to live? Have you done all you can do with diet and exercise and feel you need some additional help to gain the edge to become obesity-free? Have you considered drug therapy or surgical solutions and decided they are not the best answers for you? Then Orbera balloon-assisted weight loss system may be the answer for you. Today, we will discuss how the Orbera gastric balloon is a non-surgical, incision-less procedure that not only helps you lose weight by enforcing portion control, but is a two-part program that is designed to instill healthy habits for a lifetime with the assistance of a customized coaching program from our practice. As you can see by the graph here, over the last 20 years, obesity in the United States has dramatically increased in almost every demographic category. In fact, it's fair to say that by 2016, obesity has reached an epidemic proportion in every geographic area of the nation, but particularly here in the Northeast. New research from the U.S. Center for Disease Control and Prevention, CDC, shows that a record number of women are obese, over 40%, and 35% for men. So it's exciting to have a new treatment for patients that can bridge the gap between the medical weight loss and surgical weight loss. Obesity contributes significantly to social bias and discrimination. In addition, it places a significant burden on our healthcare system now of over $150 billion per year. In addition to an increased cost to the healthcare system, there are significant increases in personal healthcare costs as well. Many popular diet programs can cost $2,500 to $3,000 or more per year. That cost doesn't include the increase in medical expenses totaling many thousands of dollars that obese patients often incur due to health conditions related to their obesity. Until now, there has been a significant gap in the treatment of obesity in the United States, as patients were only offered less powerful methods to lose weight, such as diet and exercise, or possibly weight loss pills, or they had to make a significant jump to a surgical weight loss option that carries greater risk. But now, with the approval of the gastric balloon in the United States, patients do have that lower risk option in the terms of an incision-less procedure that is non-surgical and can really help patients get the edge on their weight loss and provide the boost that many need to get the scale moving in the right direction. My associate, Dr. Thompson, and I are proud to be among the first bariatric doctors in the New York area to make the Orbera managed weight loss system available to our patients. So what is the Orbera system? It's much more than just a device. It's a two-part process that involves implantation of the gastric balloon and meeting with our support team of experts for a period of 6 months while the balloon is in. And then after the balloon is removed, the program continues for another 6 months of very intensive monitoring to help patients make sure that they can keep the weight they lost off permanently. How does the Orbera work? It's a pretty simple concept. It's placed in the stomach and then filled with saline. Once filled, it takes up to 1/3 to 1/2 of the space of your stomach. So this will help you eat significantly much smaller meals while still feeling full. Thus, you can stick to whatever diet you're on. In the initial clinical trials in the United States, patients who received the Orbera lost 3.1 times more weight than the group that was treated with diet and exercise alone. As I mentioned in the last slide, patients can expect to lose more than 3 times the weight with the Orbera balloon than without the balloon, so you are going to see results pretty quickly. Our goal is to see patients lose at least 25 to 50 pounds within the first 6 months after the placement of the balloon. So let's take a look at how the balloon is placed. As I mentioned, the Orbera is a non-surgical procedure involving a mild sedative with the balloon being guided down into the stomach. Then the balloon is inflated to about 600 cc's of saline. The balloon is left in place in the stomach so you get full earlier while it's there. After a period of 6 months, the balloon has to be removed, so we sedate you again and look down at the balloon with a scope. We have a special catheter we can use to puncture the balloon and evacuate the saline and pull the balloon out. The procedure takes roughly 20 to 30 minutes, and the patients are home the same day after the procedure. Although many patients can expect to return to work the following day, some patients will have issues within the first week with vomiting and nausea, which is just your stomach getting used to having the balloon inside there, and we will prescribe several different medications to help address these symptoms and issues. It's important to point out that the balloon cannot do all the work for you. The patient must make a significant commitment to changing their diet and exercising regularly, as well as to come in for their appointments with our support team so that they can coach you in the right methods to lose the maximum amount of weight and keep that weight off long term. Our team will be working with you for a total of 12 months, so you can learn proper portion control and lifestyle changes that will be necessary to keep the weight off. In addition, we will suggest a program of moderate exercise. Lifestyle change is very hard to do by oneself. Most people need counseling and encouragement. However, our program recognizes that every individual has his or her own lifestyle and needs an individualized approach to changing it. We believe that the patient is really the expert in his or her own self-change. We are experts in medicine, but patients are experts on their own behavior. We elicit dialogue around that, building on any successful changes they've made in the past. Sometimes patients are reluctant to sign up for a new procedure, but it should be encouraging to know that Orbera has been around outside the United States for more than 20 years, and over 220,000 Orbera devices have been implanted worldwide. We have an experienced team of board-certified and fellowship-trained weight loss doctors and supported by a compassionate bariatric coordinator and nutritionist to help you change your life. We offer 24-hour support to our patients, especially during the first week when you may experience some nausea and vomiting. Again, as I mentioned previously, you will receive 12 months of comprehensive dieting and lifestyle aftercare support. Our offices are convenient to get to from anywhere in Metro New York and Long Island, and we can provide virtual office visits if you can't make it into our office for a counseling visit. Gastric balloons are not covered by insurance in the United States, but we do have attractive self-pay prices which include the balloon placement and removal plus 12-month comprehensive aftercare and a 24/7 access to our team. In addition to major credit cards, we have partnered with Lending Club Patient Financing to offer low-cost 100% financing for our patients without a down payment. There's a simple online application process which you can find on our website, journeytothenewyou.com. Just go to the tab marked Financing Options, and you can fill out the application and usually get an answer back on our loan status in a few minutes. Even though the Orbera procedure does not require surgery or any incisions, it is not for all patients. To qualify, you must be an adult and have a body mass index of between 30 to 40, and must be willing to participate in a medically supervised program. We are able to offer Orbera to patients with a BMI over 40, but because it lies outside the FDA indications for its approval of the balloon, this would be considered an off-label use and requires the patient's consent. The Orbera Advantage offers you a non-surgical procedure that is proven to deliver better weight loss than diet and exercise alone. The gastric balloon will help you eat small meals and learn proper portion control. You will be supported by a team of medical experts who will help you learn the eating habits and lifestyle needed for long-term success. If you'd like to learn more about the Orbera gastric balloon system, or if you would be a good candidate for this treatment or one of our other surgical procedures, there are 3 ways you may do so. Please call our phone number 631-476-9296. Send us an email to info@journeytothenewyou.com or fill out the contact form on our website. I am Dr. Hisham Atwa, and together with my associate, Dr. Charles Thompson, we are looking forward to meeting you in person and would be honored to help you along your journey to a healthier and happier you.